What is different in functional medicine approach to diabetes compared to the conventional approach? What's the major difference?
Thank you, Kunal, for saying this. So, Kunal, you know what? I was a diabetic and I promise you I tried almost everything to reverse it. But what did I do differently when I came into functional medicine and I'm able to reverse it and maintain it now for so many years? Okay. I had never checked why I'm having migraine. I had never checked my gut microbiome. I had never checked whether I am estrogen dominant and I have low progesterone. I had never checked my toxic metals. And I tell you, when I checked them, my mercury was so high that it was using all the chromium of the body I had. And we all know that chromium is important to make sure that you are not insulin resistant. So what in functional medicine we do differently than in allopathy for diabetes? In diabetes, we have these 4 medicines. You come to me, I give you first. Then you come to me, I give you one more. Then you come to me, I give you one more. And then you come to me, I give you insulin. And now we have some more things to do. But this is what we do in diabetes, in allopathy. But in functional medicine, what do? We say, okay, your sugar levels are coming high. This is a symptom. Let's see why your body is showing the symptom or why your body is asking for attention. See, I feel all these diabetes, obesity, migraine, they are all body's attention-seeking behaviors. If you consider your body to be a child, तो बच्चा रो रहा है ना? Your child is crying. You won't put your mouth on the child's mouth and say, no, don't cry. I am in a meeting. Can you do that? Right? But allopathy is trying to do that for chronic diseases. In fact, patients want that, to be very honest. So no offense against my colleagues, but yeah, you will ask, you will check whether the child is hungry. You will check whether the child has done potty and needs a diaper change. You will check whether the child is uncomfortable for some other reason, whether the child is having gas, right? Similarly, now your body is asking for attention. So you will check whether the attention is because you're nutritionally deficient. You're deficient in chromium, you're deficient in vitamin D, you're deficient in vitamin B, you're deficient in zinc, magnesium, right? Then, once you've checked that, you will check whether you have any toxins. You will check whether you have any stress. Because stress is one big reason for diabetes, because cortisol, your stress hormone, and insulin, your pancreas, which release your diabetes hormone, they're like twin sisters. They are on a zigzag balance, right? You will check how the gut microbiome is. You will check whether the patient has sleep problem or whether the patient is on CPAP machine, right? Now, when we check all these, then we take it one by one and correct them. See, interestingly, people who come to me with insulin, they are on insulin, they are type 2 diabetics, right? I promise you 90% of people, they will be off insulin within 6 weeks. Because that's not the right treatment for them at all. Yeah, you have to look at the root causes and you will be able to stop insulin for them, right? I will tell you an example here, a story which is very recent. I had a girl, 21 years old. Her PP sugar level was not coming less than 300, right? She was gaining weight from 59, she became 75.5. In a matter of 6-7 months. She went to one of the health coaches. The health coach looked at the report and said, I think this is not my case. The girl is very young. This is looking like 1.5. Some autoimmunity is hitting in. You go to Dr. Priti. So she came to me with the recommendation. I looked at her report and said, your pancreas are fine. Her C-peptide was perfect. Her insulin was nice. I said, it's fine. You have a lot of infections in the gut. I can see them from the reports. Your liver is choked and blocked for a layman to understand. Your vitamin D is low. You won't believe 2 weeks. Her sugar levels were between 85 and 130 throughout the day. Right? And that's the power of functional medicine. Yeah. She has lost 4 kgs in 4 weeks.
Amazing.
No exercise till now. Because my rule is very simple. If you are stuck on the gut, I will work on the leaky gut before I put you on too much of exercise. Only exercise she's doing is walking. She's eating more than what she was eating before. And this is her result.
Yeah, this is amazing because if you look at the conventional approach, these kind of things probably will never be even considered or looked into.
Exactly. So imagine now this girl has to travel to US for her studies. Her parents are now so relieved that they are saying we'll do shopping after a month when she loses another 5 kgs. But most importantly, their stress has gone off because they know the girl is not going to be a diabetic soon.
Right.
Similarly, I'll tell you, I had another woman. She is a case study like me. We worked on her, we put her on diet. I even put her on keto diet. She was not able to do keto diet because, her adrenals were not working too well. Her thyroids were not working too well. And then finally, and we did not do heavy metal testing in the beginning. And then finally, we saw that she was very high on mercury and aluminum. And that's the reason she was very low on molybdenum, chromium, magnesium. What we did, I started her on chelation. 6 weeks, she was off insulin. 6 months, she was off the medicines which she was taking for the last 20 years. And I'm not trying to tell everybody that everybody will be able to stop medicine. No. Second, everybody will not be able to stop in 6 months, and some people will not be able to stop at all. But what I'm saying is that all these root causes we must check, because these are going to lead to other problems also.